Hello and welcome again to Ask Dr. Gupta. In our series of videos on breast cancer, we have already discussed the non-cancerous breast masses in our previous video in quite detail. So now we shall move on to the cancerous lumps. Breast cancer is one of the most well-known and well-understood cancers. It is one organ which is easily amenable to self-examination, and it is very easy for a clinician also to examine the organ. Awareness about breast cancer fortunately is quite high. The opinions are sought early. Still, many, if not most of the cancers, they present in advanced stage. If we see this kind of picture in an organ that is so easily accessible to examination, then it will make anybody sad. Today's discussion will be on risk factors for breast cancer, on the signs of breast cancer, and on the tests that are done to confirm the presence of this dangerous but curable disease. We shall also discuss the familial risk factors, and we shall also try to discuss the ways to prevent it if possible. The first question that comes to mind of any lady will be, can I get cancer? Then the answer is that anybody can get it. This has very well described and very well established risk factors. We shall discuss them, but remember, these are risk factors. These are not causative factors. So if somebody is tested positive for any of these risk factors, then be alerted. Please don't get panicked. As I had discussed in our earlier video, breast cancer is a hormone related cancer. So logically, prolonged exposure to hormones will increase the risk of breast cancer. It happens in those ladies who start having their periods at relatively early age and those who continue to menstruate later in their ages. Such ladies should get a bit alerted. More the tissue, more will be the risk. So being overweight increases the risk of breast cancer. The extra fat in our body also changes the hormonal milieu of the body, and in that way it also promotes the development of cancer. So overweight ladies should be relatively alert. If the ladies do not breastfeed their child, or the child is fed for very short duration, then it increases the risk of breast cancer. In summary, if the organ has been denied the function it was made for, then it might not like it and might develop cancer. There are some concerns about the silicone gel implants also. The most commonly asked question about breast cancer is that does it run in families? The answer is that it is very less common, but there are some variants that indeed run in families. Tests for these genetic aberrations are now freely available and are not very costly also. If somebody is discovered to be having any of these genetic aberrations, then the person should seek immediate medical opinion. There are medicines available to address these genetic variations. You might be advised some precautionary surgeries, so please meet a specialist who will suggest you the best possible option in your situation. Now, since every lady is at risk, we should all know about the signs of this dangerous but potentially curable illness. Breast cancer generally comes as a lump, as a mass. We have already discussed the non-cancerous lumps, so we will continue our discussion only about cancerous lumps. A breast lump, irrespective of age, should be taken as cancerous lump till it is proven to be non-cancerous. This is for your safety. The signs that suggest that this is more likely to be cancerous is it being hard. If it is a hard lump, if the size is increasing very fast, if the skin over the lump has become red, if there are ulcers over this lump, or in case you notice that there is a lump in the armpit also in addition to the breast lump, all these are indications that we are dealing with a cancerous breast lump. Blood discharge from nipple might suggest a small tumor in milk channels of the breast. This tumor may or may not be cancerous, so if you notice blood-stained discharge, seek immediate medical attention. One thing should be remembered, that the treatment is started only after demonstration of cancer cells in cytology or in biopsy specimen depending on the situation. Many a times a small piece of tumor is taken to know the subtype of cancer. To normal public, breast cancer appears to be one cancer, but actually they are of different types. So we should know what kind of cancer we are exactly dealing with. For that purpose, we need a biopsy. It helps in formulating the treatment plan, and it should not be delayed because of rumors. Mammography and PET scan They are done to know the extent of disease, and they cannot be the sole basis for starting treatment. Biopsy, if being asked before starting of treatment, is not to establish the presence of cancer. More in most of the situations, cancer presence can be established by much simpler tests. This biopsy is being asked for to know the exact subtype that we are dealing with, so that we can be guided for formulation of treatment. This will ensure best results. So please do not fall for rumors and do get tested for whatever has been suggested to you. Now a word about mammography. Mammography is low radiation X-ray of the breast, which is done to evaluate breast lumps. It is also useful, very useful as a screening tool for normal ladies more than 45 years of age, in whom a small lump which is not yet felt can be picked up by mammography. In younger ladies, as I discussed in my previous discussion, the breast tissue is relatively firm. So mammography might miss some of the lumps if done in younger ladies. Ultrasound of breast, just like the ultrasound of abdomen, we have ultrasound of breast also. The ultrasound of breast is a very good tool in the young. It is also done with mammography, along with mammography, to see the areas that have been missed in a mammogram. Sometimes a MRI scan of breast might be asked for, especially in the young, when conservation of breast is being planned. A normal mammogram that looks something like this mostly rules out anything that needs intervention. Sometimes a cancerous lump in mammogram is so characteristic that you need not be a doctor to pick it up. The family points at it that this looks dangerous. PET-CT scan is done in not so early malignancies to know the disease extent, to know whether they have spread to other organs, and if yes, then to which organs they have gone to. The PET scan itself cannot diagnose a cancer, nor can it decide about breast conservation decision. So now we know that breast cancer can come in any lady. It has well-defined risk factors. It is evaluated by mammography, ultrasound, MRI, PET scan in various combinations depending on situations. It needs demonstration of cancer cells in cytology or in biopsy. In our next video, we shall discuss the treatment options, the role of each treatment component, their side effects, their problems, and their long-term results. So please stay connected. My teleconsultation phone number is mentioned in description. If you want discussion on a topic, please write a mail to us. The mail address is also mentioned. With this, I wish everybody a very healthy life, and those who are undergoing treatment for cancer, I wish all of them a very early, very speedy recovery. Thank you.